so the first thing I'm going to demo is just isolation. So you guys have an isolation practical this week, and isolation is really easy. It's just going to be, how do we isolate the mouth in preparation for either filling or sealants, depending on what we're trying to achieve. So there's different types of things that we can use for isolation. We have 2x2 cotton gauze, we have our cotton rolls, and we have what's called a dry angle, which goes along the cheek. We also have our saliva ejector, our high volume evacuator that we normally would have. There's also things called like an isolite, where it looks like a saliva ejector, but it goes in the mouth and it just stays in the mouth all the time. So it's constantly suctioning. Those are kind of common to see in offices too. For today's purposes and for your check-off purposes, we're going to be using cotton rolls, 2x2s, and dry angles. So first of all, if we're going to do the maxillary arch, what you're going to do is you're first going to place a dry angle. The dry angles there's different ones. Some of them are just like cardboard looking. These ones have a mesh on one side, a smooth surface on the other. The mesh side is going to go towards the cheek. What it does is when you put it in somebody's mouth, this mesh side will actually like adhere to the cheek and stick. So when you put it in, it's going to go like an arrow. So the arrow is going to go towards the back of the mouth, and you're going to put the end where you want it right inside the mouth. So it's going to go in like this. If you try to slide it, it will stick right like this and you won't be able to get it in any further. So you're going to put it in so that you kind of pop it in exactly where you want it. And then it will just stick there and it won't move. Okay. Then what we're going to do is we're going to take some cotton rolls. Will you grab me a cotton plier out of the drawer, please? And when you place cotton rolls, you guys know my theory. If you don't put your fingers in the mouth, then you have a less chance of getting bit. So when you place cotton rolls, if you want to place them with your finger to the buccal, that's okay. But when you place them on the mandibular under the tongue, I'd rather you use a cotton roll. And then when you take them out, you're going to be using cotton pliers too. So you can just get in the habit of taking them, grabbing it with the cotton plier, and then placing it into the mouth. When you place cotton rolls in the mouth, you want to place them where you want them, and then you want to kind of rotate it to spin it up towards the gum. What that does is it'll attach to the tissue and hold it there and kind of push the tissue back. If you just try to push it in, sometimes it'll just roll right back down, okay? So you want to place it like that. So that's going to be your maxillary isolation technique. So one cotton roll on the buccal and the dry angle on the buccal. Okay, for mandibular, you're going to do the dry angle still. You're going to take a cotton roll, place it on the buccal. Same thing, you're gonna roll it down. And then you're gonna place 1 or 2, sometimes even 3, underneath the tongue, okay? So you can either have them stick their tongue out and you can grab it with a cotton 2x2 and then place the cotton rolls underneath it, or sometimes you're just able to slip the cotton rolls right underneath the tongue without really too much fuss. Okay, so you're gonna place the cotton rolls in. So that's your isolation. When you remove it, you can't just grab onto the cotton rolls and pull them out. What do you think would happen if we tried to do that?
Just tear.
It'll stick to the tissue and you can actually tear the tissue. So what you want to do is you want to take your air water syringe and you want to squirt water in the mouth and make sure that it's saturated. With the dry angle, you're going to take the tip of the air water syringe and you're actually going to put it between the cheek and the dry angle and just squirt some water. And I kind of go back and forth and pry it from the cheek, and then you'll just grab your cotton pliers and you'll just pull it out. And when they're wet, all of it just comes out super easy. And then what you can do is you can take your saliva ejector or your HYVAC and go ahead and suction in there afterwards to get any excess saliva out. Okay, so that's your isolation technique. And you can turn up, we'll do another video for